Hi, I'm Dr. Craig Barbieri, a board-certified phlebotomist here at the Vein Clinic of Greater Kansas City. Here at the Vein Clinic of Greater Kansas City, the #1 goal of Dr. Stuckey, myself, and our staff is patient comfort and safety. We take utmost care to make sure our patients are comfortable, understand the procedures, and what is expected of them and us, both preoperatively, during our operations, and postoperatively. We pride ourselves on being board-certified phlebotomist, which is the sole dedication and treatment to venous disease. Venous disease, or varicose veins, is our primary problem that we treat here at the Vein Clinic of Greater Kansas City. Varicose veins are primary dysfunction of the valves inside the veins. As they become bad, veins dilate and become tortuous or ropey, and this is the main reason that people usually come see us. One of the reasons I really enjoy what I'm doing as far as treating venous disease is the appreciation that the patients have once you're done helping them. We see all walks of life from age 12 up to age 90. Usually when they walk out of here, they are so appreciative of what we do. During the procedure, since it is a local anesthesia only, they are awake, talking to us, telling us about their family, their kids, their grandkids, their job. It lets us get to know our patients even more, since we are spending an hour or two with them at a time. Patients present to us for a multitude of reasons, be it swelling in their legs, painful, heavy legs, discoloration in their legs, wounds, ulcers, or just spider veins that they want to look better. On a normal day for a procedure, patients will check in at our front desk. They will be given a consent and signed and make sure they are well informed, brought back. We take their vital signs preoperatively. Then we mark them with an ultrasound so we know which veins we want to treat that day. We bring them back to our operating suite. From there, we proceed to sterilely prep them by soaping their legs, putting sterile drapes around them, and then we're ready to start our procedure. We hook up our generator, which generates the heat so we can kill the veins internally. From there, we use local anesthesia to where we numb the skin so we can use our catheter to access the bad vein, and from there we treat that with heat. After that is done, we put a bandage on, and then usually your compression hose acts as your postoperative bandage on top of that. And from there we let you leave and you will go back to your routine activities for that day. You have minimal restrictions and we actually want you up and exercising. The average procedure, we tell patients, is about a 2-hour time limit from the time you check in to the time we put your bandages on, you walk out the door. After checking in and going through all the preoperative requirements, the average procedure time is usually only 45 minutes. The history of varicose vein disease dates back to decades and decades. Originally, there wasn't much you could do for it other than compression hose, and then vein stripping came along, which is a true procedure where they had to take you to the hospital, you underwent general anesthesia and would miss a week or two of work. Now it has evolved where we can do endovenous ablation, and it's the same day procedure. There's only a 2-hour time limit out of your daily routine, and you're able to do what you want to do afterwards. Current state-of-the-art treatment for vein disease is about a 2-hour block out of your time for the day. You can resume normal activities. There is no preoperative or postoperative restrictions other than wearing your bandage or compression hose. We are one of the leading centers for perforated treatments in the United States, which is the new kind of front of venous disease. As we know, it is reoccurrent. What is causing the reoccurrence? And it has been found that perforated disease is on the forefront. A lot of times patients will ask me, am I being treated with laser? Laser is a form of the treatment that we use. We have a laser. We use radiofrequency on our endovenous ablations because we still think it's superior. Laser and radiofrequency are both a source of heat. That heat is generated to kill the inside of your veins. It is harder to control the laser heat, which is light-based, than it is the radiofrequency heat, which is a microwave heat-based. So since we can control the heat better, we have less burns, less scars, less pain, less bruising postoperatively than we do with our laser. Now, as technology develops, year to year, one comes up with the other because they are direct competitors. We look at that each year before we decide what we buy, how we update our equipment.